Happy Monday, everyone. This is Todd Houghton from Houghton Physical Therapy, here for Ask the PT Live. I'm excited again for another episode tonight, just where I can add more value through the field of physical therapy, and again, having Ask the PT Live. So our outcome is to provide as much information as we can to anybody that wants to tune in, whether you're watching live right now. So if this is your first time, welcome. And if you've been tuning in before, it's great to have you back again. So the outcome again is, how do we add more value to people in the community by introducing people to the field of physical therapy if they have some questions and not really sure what physical therapy can do for them. My purpose is I am so passionate about helping people in any way that I can. So I'm here to have the biggest reach that I can and to assist people that might have some questions where they might never have gone to physical therapy. They're not sure if they need to go see a physician. They might have some aches and pains and they're not really sure who to ask. So my purpose is, again, to have the biggest reach and to help out as many people as possible. If you have any questions during this or even afterwards, you can feel free to reach me at Todd, H-T-O-D-D-H, at HoughtonPhysicalTherapy.com, and that's all spelled out. Hey, Steph, how's it going? Nice to see you. So the hot topic of the week that I wanted to discuss, kind of going along with where we started with the neck, we worked to the shoulder. Last week was the elbow. Now we're going to talk about the wrist and the hand. So the topic that I wanted to talk about this week was specifically carpal tunnel and wrist pain. Hey, Jojo, how's it going? Nice to see you. Yeah, Steph, all of us miss you as well. So really, I'm so glad you joined tonight. So again, the hot topic of the week that I want to talk about is carpal tunnel syndrome. But what I wanted to do is just give you a brief overview of some general anatomy, just so you can have a better idea of what's going on as I talk about what carpal tunnel is. So as we know, I have my skeleton friend over here. Any of you that's been in our physical therapy office, you see a few of the props behind me. But the reason that I used our friend over here today is because we're able to get an idea of the different body parts in the upper extremity. So we have in the upper extremity, we have the humerus bone, which is the big bone over here, and then we have the radius and the ulna, which are the two bones in your forearm. The radius is the one that is connected more towards the side of your thumb, and the ulna is the other one that attaches, which is where your elbow is, if you were to feel at the back of your elbow, right over here. Then we have some little small bones in your hand. There's 8 of them, called the carpal bones. And then we have the metacarpals, which is 5 of those, which forms kind of the palm of your hand. And then we have the phalanges, which are the little digits on the end of your fingers, which are actually fingers. And that's how we get the movement through there. So we have the radius and the ulna, which are the forearm bones. We have the carpal bones in the back of your hand. We have the metacarpals over here, and then we have the phalanges, which are your fingers. So I just wanted to orientate you with our skeleton friend over here. So on top of the bones that we have in the forearm, we also have ligaments. Ligaments give stability in your hand. And then we also have the muscles which move. Like I said, we're talking about the carpal tunnel and wrist today, but we have the muscles that actually move all the bones and the joints for us. Then the next thing I want to talk about was the nerves that we have. So there are 3 main nerves that come down over into your hand. The first one I'll talk about is the median nerve. And the median nerve, so if we look at the palm, we'll call this the palmar surface, the front surface, and the dorsal surface, which is the back of your hand. The median nerve gives the sensory part. Well, actually, let me step back. So if we talk about nerves, nerves do a few different things. Nerves give you the pain response, tell us where there maybe pain is, but they also give us sensation, which allow us to tell, is it hot, is it cold, any numbness or tingling going on. And the third thing that we do, that we've heard me talk about the last couple of talks, is they provide motor control. So that means giving some juice to the muscles to work. So as we break every nerve down, I'm going to talk about the sensory part of the nerve, what it does, as well as the motor part. So the median nerve controls on the palmar surface over here, and the sensory part is on the palm surface of these 3 fingers right over here, we'll say essentially. So these 3 fingers right over here, the thumb and the first 2. And the motor part of the median nerve, so we have the muscles inside of your hand. We have the flexors, which flex your wrist forward which are on the front part of your forearm over here, which flex your wrist forward. The extensors are on the back part of your arm. They extend your wrist backwards. So the wrist extensors and wrist flexors. So then we have the lumbrical muscles in your hand, which assist with some flexion and extension of the fingers. So the median nerve is responsible for the sensory part over here, as well as for flexing and extending of the first few fingers in the hand. Then we have the ulnar nerve. So the ulnar nerve, also known as the funny bone, if you bump your funny bone over here, the ulnar nerve, the sensory distribution is, well, there's a few different, there's 3 different parts of the ulnar nerve. I won't go into much detail with those, but it goes to the palm side of the fingers over here. It goes to, well, there's a palm branch, there's a dorsal branch. Basically, it controls is these 2 fingers over here. So if you hit your funny bone, you're going to have some funny feelings coming down into these 2 fingers. What the ulnar nerve does is it works the lumbrical, which are some of the small muscles in your hand, and it helps to flex those. Flex them back like that. It flexes, extends your fingers, and it also flexes your wrist. Then we have the radial nerve. The radial nerve, what that does, it's more of the distribution on the back of your hand. And what that also controls is it controls the triceps. So it controls the pushing out motion over here, and it also controls the wrist extensors. So we have the median nerve, which controls the use of the fingers. We have the ulnar nerve, which also controls the use of the last 2 digits, as well as flexing your wrist. And then the radial nerve, which extends your wrist and also works your tricep. So those are the nerves. Now, not to confuse everybody, and that's why sometimes we have what's called the differential diagnosis. So someone has carpal tunnel, we have to make sure, like we've talked about the last few sessions, we want to check a little bit higher up the chain to make sure nothing's going on with the neck. So I'm also going to go into some more anatomy and talking about some of the neck vertebrae and the neck nerves. So I'm going to grab this skeleton here. So in the neck, we have 7 cervical vertebrae in your neck. So a vertebrae is the bones that stick out in the back. If you were to feel the back of your neck, you can feel the vertebrae back there. So we have 7 cervical vertebrae in your neck. Now, the 4th one in your neck provides sensation to the base of your neck. The 5th one, the 5th cervical vertebrae, it gives you sensory to the front part of the shoulder. And it also, the motor control of the 5th vertebrae is for elbow flexion to bend and extend your arm. Then we have the 6th cervical vertebrae, which gives sensation all the way down to your fingers here, to these 2 fingers, the thumb and the first one. And the motor control of that is also wrist extension. For the 7th, it actually controls sensation down the middle of the hand, okay, right down to the middle of the hand. That's responsible for elbow extension. Then we have the 8th cervical vertebrae. So the junction C7 to T1 is that it controls the inside part of the hand. And what does that do? That controls also finger flexion. So the reason I wanted to show you that when someone comes in and they may have an issue if they have numbness or tingling or funny feelings in their hand, we as physical therapists from the health field, we need to really do some investigation to see, is it coming from the neck? Because there's a lot of crossover from the vertebrae in your neck and actually some of the nerves that come down into your hand. So it can be coming from both areas. Okay, so now that we have some anatomy going on, the next thing I want to talk about was, as we're talking about carpal tunnel, so if everyone kind of looks down at your wrist, and if you look at my wrist, as I wiggle my fingers right over here, we're going to see a lot of the flexor tendons moving around. Well, there's something called a transverse, which means it's coming across the transverse carpal ligament. And what that does is it crosses over in the wrist area, that it kind of houses all the tendons, and it also houses the median nerve, which, like we talked about, gives the sensory distribution to the inside of the thumb and these 2 fingers and controls the use of your fingers over here. So what happens with carpal tunnel is we can get some scarring of the transverse carpal ligament, and what happens is you can imagine there's not a lot of space in there. So it's almost like it's putting some pressure. If you're looking at putting pressure on the wrist, which we know what nerves do. Nerves give us sensation, they give us feelings of pain. They also give us muscle control. So if we have the pressure over here, it can affect any one of those. It can affect your sensation, it can affect your grip strength, it can affect your finger motion, it can also give you some numbness and tingling. So that is what carpal tunnel is. Well, like I just talked about, what does this mean? So when someone has the carpal tunnel type symptoms, we want to say, oh, hey Brenda, how's it going? Hi Shelly, how are you? Thanks for tuning in. Hi Ron, nice to see you tuning in as well. So what does that mean? So we have the nerves. If you get a compression or something pinching up over here, then it can cause the symptoms down to the finger. Like I said, weakness, numbness, tingling, which can be really uncomfortable. So who typically gets carpal tunnel syndrome? Well, typically it's someone that has any type of repetitive motion, someone that has, I have a mouse over here on the table over here, someone that does a lot of computer work, typing at a desk, someone who does a lot of repetitive work like an electrician, someone's using their hands, through a lot of repetition, where we're getting the flexors and the extensors moving in there a lot, creating a lot of scar tissue at the transverse carpal ligament. So I could also be a cook, I said plumber, electrician, anyone that uses their hands quite a bit. But it does really happen to a lot of people with desk jobs. All right, okay. So the symptoms of carpal tunnel. Someone that might come in and from a subjective assessment, when someone comes in to see us, some of the things that they might commonly say when they do have the carpal tunnel type symptoms. Well, I came in, my hand falls asleep. They may get, oh, I just kind of feel like I have the pins and needles, like I said, when you get the funny bone, but it stays a long time. So hands might fall asleep. You might get pins and needles in the hands. You might drop objects, because remember, what did I say? If we get a compression of that ligament, we're affecting the nerve, which affects the sensation, the motor control. So dropping objects, trouble with your ADLs, trouble washing your hair, trouble holding on to a cup of coffee, trouble getting dressed, those types of things could really bother you. That's a subjective, what the patient comes in. Objectively, what I might see is that I will actually see when I do a sensory test that there is actually numbness and tingling. They have a sensory deficit. They might have swelling all the way down by just the pressure. They might have swelling in their hand, and they're definitely going to have some weakness, and they're also going to have pain. So what are the tests that people would have if they had carpal tunnel syndrome? Well, a physician might do, say, an x-ray first, which is just going to show bones, spaces where there should be spaces, not really a definitive test. They might do an MRI to see if there's compression of the nerve in there. But the big test that they do is called an EMG. The idea of the EMG is they have some electrodes, and what they do is they're looking to trace the electrodes, the impulses that we get, how we said the nerves travel all the way down. They're going to send an impulse from your neck, and they're going to see and have some sensors down all the way in your hand and see how far down the sensors go. If they're getting blocked to the median nerve distribution over here, that's usually a positive sign of an EMG. So what could be the treatment for someone that may have carpal tunnel syndrome? Well, the first thing I talked about, that I've talked about pretty much every session, is kind of the fuse box theory. Is we want to check, hey George, how's it going? Thanks for tuning in, buddy. So the fuse box theory is we want to make sure that the cervical spine and everything is clear. So we want to make sure that we're contracting all the muscles at the fuse box to make sure we have all the strength to the plugs, meaning that if we have really good posture, we're opening up all the nerves and the pathways that they're going to send enough juice to the muscles to work. So that's the first thing. I'll always take a look at the cervical spine first, clear that, do some exercises for the cervical spine. I really work on people's posture, very important, like we've talked about the last couple of times, to make sure we activate all the fuse box. We can mobilize the thoracic spine, which is your mid-back. Then we can get down to, if we've cleared the neck, we've worked the shoulder, we've worked the elbow, now we're down to the wrist. So we might do some soft tissue massage around the wrist. We might try and break up the scar tissue around that ligament. We may use some Graston. We'll typically do some wrist stretching, flexion, extension stretching, some strengthening exercises with some dumbbells. And if that doesn't work, and also I would say that we would definitely want to get you in some night splints. Because part of the reason why people have carpal tunnel is when they're in a position here, if you are going to be holding a mouse, that your wrist is up into wrist extension as you're using the mouse. So people get carpal tunnel because their wrist is not in a neutral position. It's from being jammed up like this for so long. So something that would be really helpful is to have a mouse pad. So when you hold a mouse pad, it holds your wrist in a good position. That's just an idea that people can have. And if that doesn't work, after the night splints, after some changes in your ergonomic setup at work, there's other things you can try, other types of medicine, chiropractic, acupuncture. You'll go to a physician, they might want to do some steroid injections, and then eventually if that doesn't work, you might be a candidate for surgery. Hey Emily, how's it going? So now what I want to get to was a few questions. If anyone has any questions, so please write in with any questions. I love to answer questions. So we have a few questions.
Ron says, what types of exercises can you help?
So Ron's question, thanks Ron for checking in tonight. So Ron's question is, what types of exercises can I do to help with this? So the first thing I always want to do is I make sure that we have all the core exercises in order. Now, knowing that we have all the core exercises, you really work your posture, which is the most important thing for people to do. Once you've done that, then we want to work on, so we want to start proximal and we want to work distally. So we want to do some strengthening exercises for your neck and your core. Then we want to work on some shoulder stability exercises, elbow, and then we wanted to get some wrist exercises. I don't like to start with the wrist dumbbell exercises that people typically do, because to me, it's kind of treating more of the result of something that could be potentially coming from the neck. So I always want to start with strengthening the core and then work our way down.
Nancy has a question. I have pain at the base of my
thumb. I got it. Hi Nancy, how's it going? Thanks for joining in. Nancy's question is, I have pain at the base of my thumb all the time. Don't think it's carpal tunnel. So probably what I would do is, if you've had the symptoms for a while, I would definitely go see a physician. I do have people that come in that they feel that they have carpal tunnel, and they have the MRI is negative, the EMG is negative. And in that case, I would be going up to the cervical spine to check the cervical spine out. Because if you remember from what I said before, is that the 6th cervical vertebrae gives sensation and some feeling to, we'll call it like the 6 shooter, gives sensation to the thumb and the first digit and a little bit of the next one. So those are the fingers that bother, but especially the thumb. So I would check out your neck and your cervical spine. We also have different areas where the nerves kind of come out. So they come out your neck, all the nerves from your neck come out, they come underneath your collarbone, and then they go down your arm. So I would be checking some of the sites where the nerves can kind of be entrapped. So that's where I would probably start. And then if I would work all the way down, and then I would eventually take a look at your thumb and see, is it a thumb issue? I don't know if you've had a thumb issue for a while, if that's something new. If it's been more of a chronic issue with no onset, I would definitely start up here on the neck. I saw that Shelley had a question. What was Shelley's question?
A desk job where I'm on the computer all day, what are some changes that she could make to her workstation?
So Shelley, thanks for the question. So Shelley's question is, she has a desk job all day and wants to know what changes could she make at her desk that might be helpful if she's having wrist pain. So again, if we're starting from, so through my eyes, is that we need to make sure that your posture is really important. So I would say probably the first thing you want to do is, well, a few things you can do is you want to have a really good ergonomic chair set up. You want to have a chair which your arms are supported, or if not, you want to have your hands or your forearms on a desk where they're supported, and you want to have support. I mentioned you use a mouse a lot, so you want to have support, like I showed you for the wrist pad, where it's supporting your wrist, and you want to keep your wrist in as much of a neutral position. This would be extended, this would be flexed. You want to keep it in as much of a neutral position as you can. So if you're looking straight on, you want to have your monitor the right height. So the chair's the right height. We have your wrist set up, everything, your hands are on the keyboard. And sometimes you can even get an ergonomic setup for a keyboard, which when your kind of hands are a little bit turned out to the side. So as you're looking at my hands right now, because a lot of times most keyboards have you straight down, which can torque your wrist. So there are some setups on the keyboard where they're slightly tilted out, as well as having your mouse close. Then I would just make sure that your monitor is the right height, make sure it's tilted the right way, because you don't want to be looking so far up or so far down. You want to have it in a good position. And if you have a few different monitors, again, you want to make sure all the monitors are set up in a good position to make sure that you're really not having to look up or down at anything. So your chair set up, making sure your posture, making sure you have good back support, as well as good wrist forearm setup. Great question.
Tracy asked about hairdressers getting carpal tunnel.
I'm sorry, what was the question?
Hairdressers getting carpal tunnel.
So thank you, Tracy, for your question. Tracy's question was about hairdressers getting carpal tunnel. That's something that's really, really common, especially for hairdressers, because they do have a lot of motion with their wrists open and closing their hands all the time. So they can easily get some scar tissue built up over here in the ligament. A lot of times too, so we talk about the fuse box, and if you're having good posture, we're generating enough strength down over, all the way down to the plugs, all the way down to your fingers. If you don't have good posture, you tend to slump over, that's going to challenge your neck and your cervical spine, which could possibly generate some pinching effect, which is going to give you weakness in your hand, which is going to make you work a lot harder for really no reason. So sometimes, well, I say every time, especially with hairdressers, you really want to have as good posture as you can, making sure your clients, I know a lot of the chairs go up or down, so you don't want to be hunched over and reaching. You want to be as upright as you can with good position for your hands and for your elbows. So it's super important for hairdressers, yes. You're welcome, Shelley. I'm glad that was helpful. Great. So we have some questions that I didn't get to last week, so I just want to go over a few of those questions. I have chronic wrist pain, and my doctor mentioned several possibilities. He said, my symptoms seem to point to either carpal tunnel syndrome, tendonitis, or repetitive strain injury. How do I tell the difference? So one of the questions that we had before, I answered that a little bit, but I'll go into it again. With carpal tunnel, really the definitive diagnosis of the diagnosis of choice is the EMG. So if you have an EMG that's negative, meaning that it officially is not carpal tunnel syndrome, but you're still having those pains, I would start. And so what is a tendonitis? A tendonitis is an overuse of the tendon, kind of repetitive use. If we have a normal muscle, say you're doing bicep curls, for example, and we're working the muscle, how we make the muscle stronger is we get small little micro tears in the fibers. And then what happens if we give it enough of rest, a day or two? That's why we don't want to do the same workout day after day. So say you do some bicep curls on Monday, we've torn some of the muscle fibers down, but then we give it a day or two to actually generate some rest, some healing, and then the tissues get bigger. But if we do it day after day after day after day, the same repetitive motion, then we get the scar tissue built up, but it never really gets to heal. When it doesn't get to heal, that's how we get the overuse injuries. That's how we get the buildup of scar tissue. Then we get some changes in the tendons, and we get changes in the tendons. They can be very painful. Then we get the shortening of the tendons. So that's one of the things that I would also check for. Do you have a type of tendonitis going on as a result of some type of repetitive injury? So a tendonitis, a repetitive injury is pretty much the same thing. But in either case, if we're dealing with wrist issues that's negative to carpal tunnel, I'm always looking at the cervical spine. I just had someone come in today, and they were having pain down into their wrist and their forearm. So I worked up on, and they hadn't been getting better. They had tried some other modalities to get better, but it wasn't really working for them. So I started right in on the cervical spine. I did some mobilization on the right side, which is a right-handed person, on the same side of the cervical spine. And when I did that, it alleviated 70% of the symptoms down into the wrist and the forearm. Then I did some neck stability exercises, and when they did the neck stability exercises to turn on the fuse box, it generated enough power that pain decreased by another 15 to 20%. So in just a visit today, the good news is this is kind of an acute pain. When something's more acute, it's easier to get better for us. It's like having a new house, doesn't break down as much as an old house. So when I was able to work that with an acute person, I got her 75, 85% better with one visit just by working on a few different things. So with her wrist and her forearm pain happened to be coming from her neck. Not saying that's with everybody, but that's just what I'm finding. And that's a place where I would start. George. How's it going again, George? Thanks for tuning in. So George's question is there alternative to surgery if you were told it's definitely carpal tunnel. I would say I would definitely try some of the soft tissue. So a lot of clinicians do dry needling. So dry needling would definitely be an alternative that you would want to try. I would also say Grafton, doing the stainless steel instrument that we use to kind of break up some of the scar tissue in along those ligaments over here, working down into the thumb, working down to both sides of the arch of your hand. I would also try, so dry needling is a little bit different than acupuncture, but I would also try some acupuncture as well. And I would definitely try all those for a decent amount of time, along with the physical therapy, before I would do anything as far as surgery related. And of course, you can do the stretches, you can do the night splints. Those are the types of things that I would definitely do. Thanks, George. Great question. Hey, Deb, how's it going? Nice to see you again. Hi, Wendy. You're a friend of Steph, Carol's, and Nancy's. Great. They're great people. That's awesome. They gave great reviews. That's awesome. Well, thanks for tuning in. If you have a question, I'd be more than happy to help you and answer it out. And I can't see it.
What is trigger finger?
So, Peggy, thanks for tuning in. So, Peggy's question is, what is a trigger finger? So just like the carpal tunnel ligament over here, we also have, as the tendons come up into our hands, it's just kind of like a bunch of ropes. And you can imagine that if we didn't have a way to control where those ropes are, the tracks, if you want to think the tracks that they were and to keep them in the tracks, then they could be kind of all over the place. So we do have some ligaments that actually hold the tendons from kind of going out of track through some repetitive, it could be from a slight trauma, but it's usually from some repetitive injury over time that we've developed some scar tissue usually right over here or kind of in the base of your hand, that we have so much scar tissue that the tendon should be gliding nice and easy in the sheath that it's in to actually make your fingers move. So a trigger finger is when sometimes you'll feel a nodule, you feel a lot of excessive scar tissue built up, where it's putting pressure on the tendon, and then it kind of locks. So when it goes, it will kind of like just pop up. And sometimes you have to actually manually strain it out. So that's what trigger finger is. I guess probably from the old West days, trigger finger, because they were using their guns so much that just by the repetitive use on the fingers over here, that the ligaments got a lot of scar tissue in there and the fingers would actually get stuck. So one of the things you could do for that is some self-massage. Also physical therapy helps out. A lot of times they'll even do like a cortisone shot in there to help with the inflammation, because it's just inflammation and scar tissue built up over there. Doing some soft tissue massage is good, doing some Grafton, some dry needling. Those are all things that could be effective as well, Peggy. Awesome question. Hey, Doug, how's it going? Thanks for tuning in tonight. Awesome pictures. I love your Facebook posts, Doug. So the next question is, will wearing a splint cure my carpal tunnel syndrome? Through my eyes, once the scar tissue is already there, I'm going to say it's not going to cure your carpal tunnel syndrome. But remember, it is an inflammation, and if we do have swelling in the wrist, sometimes the swelling is not so bad. So some things you might want to think about. A kind of a side note is if we want to get rid of swelling from the body, we want it to be above our heart. So if you're lying down, if you can kind of elevate your hand, that'll get rid of some of the swelling. So it's not going to cure, the nice splint isn't going to cure your carpal tunnel, but it can kind of keep it at bay a little bit, and mostly just to keep it from the flex forward position or just in the extreme motions, to keep it in a nice neutral position. So it's not going to cure it, but I think it can definitely be helpful for you. The next question is, am I going to have to change jobs due to my carpal tunnel syndrome and my hand pain? I don't think, well, all the different treatments that we talked about tonight, starting with making sure the neck is in order, making sure the core is in order, making sure we've gone down the whole chain, the proximal all the way to the distal, through all the different treatments, whether it's physical therapy, whether it's massage, whether it's acupuncture, chiropractic, dry needling, all the different modalities that we had. When you actually need carpal tunnel surgery, the recovery is usually really quick, and it's not something that people usually have to have done again. The recovery time is, 4 to 6 to 8 weeks, pretty much back to normal activity. So it's not really a long recovery as, say, a rotator cuff repair, where you might be out of work 3 to 4 to 5 to 6 months. So if you keep doing the same activity at your job, could it hinder and make it worse? It absolutely could, but I don't know if it means you have to change your jobs. And the last question I'll take for tonight is, will the symptoms just go away from carpal tunnel? That's a really good question. I don't, honestly, I would say that if you're doing all the right things, there's a possibility you could keep it at bay. And just because you have carpal tunnel doesn't mean that the symptoms are going to be consistent all the time. So I'm going to say they're not just going to go away, but I know people that have had carpal tunnel for a long time, and they just deal with the symptoms. So just in ending tonight, I really want to thank you for tuning in tonight. I look forward to this every day. This is a really great way for me to start off the week, to try and find time to add more value. If I can add value to any of you here listening tonight, if you have any, hopefully I answered your questions about carpal tunnel and wrist pain. Feel free, again, reach me at todd@HoughtonPhysicalTherapy.com, or reach out to your physical therapist that's in your area. All of us here are to help you out, and I hope this is really useful. So thank you very much, and I'll look forward to seeing you guys all next week. Have a good one.